Knock, knock, knock.
Come on in.
Hi, how are you?
I'm good. How are you?
I'm good, thank you. My name is Jessica Prino. I'm a nurse practitioner that's going to be examining you today. Are you familiar with the role of a nurse practitioner?
Yes, I am.
Okay, so I'm an advanced practice nurse that's able to assess and prescribe for you. Okay. Can I have your name and date of birth?
Gretchen Johnson.
And how would you like me to address you?
You can call me Gretchen.
Gretchen?
And my birthday is June 6, 1976.
Okay, and what brings you in today?
I'm just here for a well checkup.
Alright, so I'm going to give you a full exam. I'm going to start from your head and work all the way down to your toes. It's going to take a little bit of time, but we'll get through it.
All right.
Alright, so I'm going to go wash my hands really quick, and then we'll start with some vitals.
Okay, great.
Alright. We'll start with your blood pressure.
Okay.
We'll do this arm first. Stop there, Hannah.
It's okay.
Have you had a history of high blood pressure?
No.
No. And relax your arm. There you go.
There we go.
.125 over 80,
Okay.
which is within the limit. Now I'm going to do the other arm, okay?
Okay.
.125 over 85, so pretty consistent there.
Okay.
Actually was.
Good.
So I'm going to do it again on the right arm, and I'm going to ask you to stand up.
All
when I
right.
do it. Just checking to make sure that your blood pressure stays stable when you're rising. Okay. .115 over 70.
Okay.
So pretty consistent. Great. I'm gonna have you have a seat again.
All right.
I'm just gonna count your pulse.
Okay.
For a full 30 seconds. Okay, your pulse is 70 beats per minute, which is within normal limits. We like it to be between 60 and 100. Next, I'm just gonna stare at you for a minute and look at your respirations, okay?
Perfect.
For another 30 seconds. Okay, 16.
Okay.
So that's also within normal limits. So now that I've assessed your vital signs, I'm just gonna look at your general appearance, your posture and tone, your alertness. Do you happen to know what year we're in?
2020.
2020, and what month?
December.
And let's see, what holidays coming up?
Christmas.
Christmas, perfect. Next, like I said, I'm gonna start from your top of your head to your toes. So I'm just looking at your head, I'm looking for symmetry, it's very symmetric. I don't see any kind of masses off hands. Next, I'm gonna palpate and make sure that there's no masses or lumps or anything like that. Do you have any areas of tenderness that I should know about?
No.
No, okay. I'm gonna look to your scalp, through your hair, in a few spots. Okay. Any issues with hair loss or changes in texture or anything like that? Okay.
No.
Next, now that we did the head, I'm gonna work down the face, so I'm gonna check your sinuses. I'm checking for sinus pressure. So I'm gonna push in a few areas, one of which is right here. You just tell me if there's discomfort there.
No.
No? Right here?
No.
And then right in here.
No.
No tenderness?
No tenderness.
Next is TMJ. It's the joint right here with your jaw. I'm gonna put my hands here. I'm gonna ask you to open and close. Go ahead and open, close, and again. Open, close. Go ahead and clench your jaw. Okay, now can you move your jaw side to side? The other side, okay, and then kind of out. All right, perfect. Next, I'm gonna test your nerves in your face and make sure that you can feel the light touch.
Okay.
Okay. Can you feel that?
Yes.
How about there?
Yes. Yes.
Yes. Okay. Let's see. So next I'm going to assess your, can you go ahead and smile for me? Okay, and frown. Puff your cheeks up. Okay, raise your eyebrows. Now close them tight, your eyes, and I'm gonna try to open them, don't let me. Okay. Next I am going to, I'm just looking at your eyes, and I'm looking at your conjunctiva inside the eyes, making sure that there's no pallor or increased redness. I'm looking at the white part of your eye, your sclera, making sure that there's no icterus or what we call jaundice. And everything looks really good. Your eyes are symmetric. Next, I'm going to check your vision screening. Do you wear contacts or glasses?
No, I don't.
Okay, so I'm going to just use this little card. You're going to hold it out in front of you with your arm.
Okay.
And then I'll have you use one hand to cover your right eye.
Okay.
And read the smallest line that you can.
LTFPH.
Okay, and then release that and cover your left eye.
LTFPH.
Okay, and then with both eyes.
LTFPH.
Great. You did really well.
Thank you.
Next, I'm going to check your kind of peripheral vision. So I'm going to have you just look at me, and then I'm going to ask you when you can see my fingers wiggling.
Okay.
In your vision. Okay. You start.
Yes. Yes.
Okay.
Yes. Yes.
Yes. Okay. Now stare at my finger,
Mhm.
and you're just not without moving your head. You're just going to watch my finger.
Okay.
Right in the center, and then keep watching. Perfect. Next, I'm going to shine a light in your eyes, and I'm going to watch how your pupils constrict. So I'm just gonna, I would dim the light a little bit.
Okay.
And you can just keep staring straight at me. I wanna make sure that they are equal, round, and reactive when I shine the lights in your eyes. Okay. The pupils are equal, round, and reactive in that side. I'm gonna do it once more, okay? Great. Now if you stare at this, then go ahead and look behind my shoulder and then stare back. Okay. Now if you could, cover one eye and look at me and then uncover it. Cover the other eye, look at me and then uncover it. Okay, good. So, next I'm going to look inside your eye.
Okay.
With my light. So I'm just gonna use this tool, has a light on it, and I'm gonna get, I guess, a little bit more in depth into your eyes. So you can just stay looking straight ahead.
Okay.
I'm gonna place my hand here for stability, and then I'm just gonna come, make sure I'm at 0. There we go. You see the red reflex moving in. Okay, the optic disc has clean margins. I don't see any papuloedema. The veins and vessels are there. Next, I'm going to go to this side. Start back at 0. See my red reflex. Okay, the vessels are intact. Optic disc has clean margins, no papuloedema, everything looks great.
Okay.
You okay?
Yep.
Next I'm going to, now that we've done the eyes, I'm going to go to the ears. Okay, so I'm just inspecting them. They're symmetric bilaterally. They're soft. Do you have any tenderness there?
No.
There's no visible cerumen on the outside. They're pink and they're warm. Next I'm going to do assess your hearing. Have you been told that you have difficulty hearing?
No.
Okay. I'm going to do a whisper test.
Okay.
So I'm just going to stand like this, and I'm going to repeat, and you're just going to, I'm going to say a phrase, and then you can repeat it back to me.
Okay. 45.
Okay. And then again over here.
52.
Perfect. Next, I'm going to assess vibration and see if you can hear vibration equally in both ears by using this tool.
Okay.
I'm going to start by placing it in the center of your head, and you can tell me if you can hear it bilaterally, okay?
Yes.
Okay, just tell me when it stops. You can hear it in both the right and left ear.
Yes.
Okay.
Stop.
Okay, perfect. Next, the next test is the Rhine test. I'm going to hit it again, and I'm going to place it behind your ear. When you can no longer hear it, I'm going to place it in the front by your ear and see if you can still hear it, and then you can tell me when you don't hear it anymore.
Okay. Okay.
Are you still here?
Yep.
Okay. Okay. Now I'm going to go to this side.
All right.
Good. Good. Okay. So that concludes that portion. Next, I'm going to look inside your ear.
Okay.
Using my otoscope. I am going to start with this ear. I see the tympanic membrane, it's pearly gray, there's no bulging. I see my cone of light, my handle of my malleus. Everything looks good, no infection. You doing okay?
Yep.
Again, over here, everything looks okay. No redness, no bulging of the tympanic membrane. It's pearly gray. I see my cone of light. Everything seems to be okay in there. Working my way down, the next is your neck. So I'm just looking, I'm inspecting for symmetry. I am, can you go ahead and swallow for me? Okay. Next I'm gonna palpate to make sure your trachea is midline, which it is. Next I'm gonna palpate your cervical lymph nodes, okay? I'm gonna start back here, occipital lymph nodes, and I'm gonna work my way around. And your posterior cervical chain, anterior cervical chain, your supraclavicular nodes here. Nothing feels enlarged. Is there any tenderness?
No.
Everything feels very mobile. Nothing that I'm concerned about with your lymph nodes. So I'm going to then, let's just check your range of motion while I'm in the front. If you can go ahead and turn your head over your right shoulder and over your left shoulder. Okay, turn and face the ceiling. And then look at the ground. Touch your right ear to your right shoulder, your left ear to your left shoulder. Any pain or resistance with those movements?
No.
No. Okay. Next, I'm going to listen to your carotid arteries with the bell of my stethoscope, and I'm listening for any bruits suggestive of atherosclerotic disease. Just hold your breath. I did not hear any bruits, so that's good. Next, I'm going to step behind you and check your thyroid as you're swallowing. I'll palpate. Go ahead and swallow. And then go ahead and look down to the left and swallow. And then down to the right. Okay, any pain in your thyroid, any feelings of swelling?
No.
Okay, if there was, I would assess it more by auscultating the thyroid.
Okay.
Now that I'm back here, I'm gonna kind of work my way down the back of your neck. I'm gonna just palpate your cervical spine.
Okay.
Okay, everything feels good.
Yep.
While I'm actually here, can you shoulder shrug up and push down? And then I'll just do it in the front. I'm gonna go ahead and have you turn into my hand.
Mm-hmm.
Good. In this hand.
Mm-hmm.
Good. Okay. I'm gonna move back to the back, and I'm going to kind of work my way down your lungs here. I'm just gonna inspect the posterior thorax, and I'm looking for symmetry. I'm looking for any bulging or defects in the back. I'm not seeing anything. So I'm gonna go do some light palpation just to see if there's any tenderness that you might be having. Anything tender? No. Next, I'm going to assess vibration by having you say the phrase 99 over and over again until I tell you to stop, okay?
Okay.
Go ahead.
99, 99, 99, 99, 99.
Perfect. Next, I'm going to percuss the back. Actually, first I want to do symmetry. So if you want to go ahead and take a deep breath for me. Okay, that symmetric expansion with 2 centimeters. It's great. Next, I'm gonna percuss. I'm just gonna do a little tapping, okay?
Okay.
Next, I'm gonna percuss while I have you take a deep breath. Go ahead and release your breath. I'm gonna bang on your back just a little bit.
Okay.
So I'm gonna check for tenderness in your kidneys. You just let me know, okay? For any? 1, 2. Any tenderness?
No.
No
No.
tenderness? Okay. Next, I'm gonna use my stethoscope and I'm just gonna listen and have you take a series of deep breaths when I place the stethoscope. And please do it with your mouth open. Ready? And a deep breath. And again. And again. And again. One more. And again. Okay, great. Lungs sounded clear bilaterally. Everything's going good. Next, I'm going to do the same, basically the same thing that I did back there. I'm just going to repeat in the front.
Okay.
So I'm going to start inspecting and making sure that there's no obvious deficits with your chest cavity. Next, I'm going to just palpate for any tenderness that you might have in the ribs or. Okay. I'm going to also ask you to do the phrase 99 again while I'm in the front.
Okay.
Okay, go ahead.
99, 99, 99, 99, 99, 99.
Okay, great. I'm gonna percuss just like I did in the front, okay?
Okay.
Right in the back. And I'm going to listen to the lungs. Take a deep breath. And again. And again. And again. Again. One more. And another one. Okay, great. Any shortness of breath?
No.
Okay, everything sounds really clear and equal.
Okay.
So I'm happy with that. Now I'm going to assess your breast. Basically how they look in different positions.
Okay.
Sometimes if you have masses in your breast, there can be tenting in the skin and things like that that people don't really observe in a normal day-to-day life. So I have your arms at your side. Now I'd like to see you with your arms at your hips. Okay. I'd like to see you with your arms over your head. I'd like to see you bent over, your arms at your side. Next, you can go ahead and rest. I'm going to take my hands and I'm going to raise your arm and I'm going to check your axillary nodes, okay?
Mm-hmm.
And I'm going to palpate in a circular motion, looking for any enlarged lymph nodes in here. There's also lymph nodes in your arm, so your epitrochlear nodes, which I'm not feeling, so that's good.
Okay.
You can rest that arm. I'm gonna go ahead and do the same thing over here. You doing okay?
Yep.
Okay. Now we're at the arms. I'm gonna feel your skin. It's warm and dry and pink. No concerns with the skin. No obvious lesions. Not really any moles. You do have some freckles. You have fair skin. You use sunscreen.
Yes, I do.
Okay, good. I'm gonna just feel your pulses.
Okay.
They're equal bilaterally, +2 pulses, radially, brachially, +2 as well, even. Okay. Let's go ahead and do cap refill. Less than 3 seconds with cap refill. While we're here, I'm gonna assess arm strength.
Okay.
So if you wanna go ahead and hold your arms like this,
Mhm.
I'm gonna try to pull them
Okay.
outwardly, and don't let me.
All right.
Perfect. This one. I'm gonna try to push it in. Don't
Okay.
let me. Okay. Can you squeeze my fingers?
Yep.
Okay. Nice and strong and equal. Okay. Next, I'm going to listen to your heart while you're sitting,
Okay.
and then I'm going to do it at once when you're laying down. Sometimes when you're sitting, you can hear murmurs that you can't hear when you're laying down.
Okay.
I'm going to listen in 5 spots, starting with your aortic. Try to hear your pulmonic. Tricuspid and mitral. And your apical.
Okay.
Everything sounds really good. The next sound, I'm going to have you lean forward.
Okay.
Go ahead and exhale. Okay, I'm hearing S1, S2. I'm not hearing any murmurs, any clicks, any gallops.
Okay.
Your heart sounds within the normal limits. I'm happy with that. So next, I'm going to have you lie down.
All right.
On the bed here.
Okay.
Of course, I'm going to have you in an appropriate gown.
Of course.
Um,
Does that look right?
it does. Oh. Yeah. Next, I'm going to assess the arteries in your neck.
Okay.
One of which main arteries is your jugular vein. So I'm going to have you turn your head to the left. I'm going to use lighting to shine up and find a pulsation of your jugular vein. Here it is. And then I'm going to use 2 cards to measure the midclavicular. And your JVP is 2 centimeters,
Okay.
which is within normal limits. Okay. Next, I am going to inspect your anterior cardiac silhouette here. I'm looking once again just to make sure everything's symmetric, that there's no obvious deficits there. I'm going to palpate for heaves and thrills.
So, you're interested in
I'm also gonna palpate for the point of maximal impulse. That's great. Next, I'm gonna listen to your cardiac, 5 cardiac sounds while you're laying down, okay? I'm gonna do that with both the diaphragm and then the bell. So we're gonna start aortic again. Pulmonic.
Hey. So, can you, ready to go home?
Tricuspid and mitral. And your apical.
So, go over, hey.
You switch to the bell.
Everybody else is downstairs, one person up, so.
So I was thinking, without you, there would be no white knight. Without the white knight, it would be no nest.
I'm gonna have you turn to your left side.
Okay.
Hence where with you, I would have been famous.
I guess all of that is true, yes.
So, in light of that,
Okay, I hear no extra sounds.
Okay.
No gallops, no S3S4. Everything sounds great.
made it very free.
Okay, and then once again, I inspected your breast when you were sitting in the chair. Now I'm gonna palpate while you're laying down. I'm
Okay.
gonna use a circular motion in each breath, and I'm gonna go inward towards the nipple.
Okay.
Once again, assessing for any lumps or masses that I can find.
So is it Margaret at all?
No, but Daniel did. According to him, Max cleaned up his and Margaret's who went to counts 18 years ago and vanished.
No discharge from the nipple.
She later
Okay.
had it break into a storage locker by Max's
And
father in town.
axilla, everything's fine.
Which lived up here.
The crazy part is, Margaret would have gotten away with it. Oh, good job, baby.
I guess that is.
I don't understand. How would Margaret have gotten away with murdering her
And discharge from that nipple. Everything is.
Go away from killing her husband.
You doing okay?
Yeah.
But had
Okay.
revenge and
Next, I'm going to work down to your abdomen. Okay.
Okay.
So right now I'm inspecting for symmetry and contour. I'm looking that it's not concave, it's protuberance, and I'm looking for any notable peristalsis. I'm looking for any pulses that I can see. Next step, I'm just gonna listen. Okay, I'm gonna listen all 4 quadrants and then also your abdominal arteries with my stethoscope.
I do know a way that Thomas shows appreciation for all of us. But didn't I just do that? Well, deeds matter more than words, Thomas. I think you could buy us all a few drinks of Bavaria.
I like that idea.
You did.
Okay. Some clicks and gurgles are appropriate. I'm gonna listen to your aortic artery.
Oh,
Iliac. Renal.
Well, you know, we did a good job. I'll be able to get back.
That will be some.
Femoral.
I don't be responsible. Appreciate it.
Huh?
Ouch.
Let's take that down. Next I'm going to percuss.
Okay.
In 9 different sections.
Oh, you cleaned up all the blood.
What's it easy?
Okay. I'm gonna use light palpation.
You know, just normally when people go through a near-death experience.
Okay. No tenderness there.
No.
I didn't sense any rigidity, so I'm gonna go in with deep palpation now.
Okay.
But it wasn't coming.
Well, it would have, but it could have.
Okay. Next I'm going to assess your liver.
Okay.
Okay. So I'm gonna place my hand under here. Go
Okay.
ahead and rest back onto it.
All right.
Take a deep breath.
I mean, you study about the battle in New Zealand.
Okay. I feel the liver edge.
Okay.
It slides through my fingers. Everything feels, it doesn't feel enlarged or anything like that.
Okay.
I'm gonna do a similar process on the sleeve. Go ahead and
Okay.
rest back on my hand. I'm gonna push up. Go ahead and take a deep breath. Exhale. I don't feel any splenomegaly or enlarged spleen, so that's good.
Okay.
While I'm over here, I'm going to feel for your kidneys. Okay, and the other one over here. Everything feels great.
Okay.
Next, I'm going to feel your femoral pulses, right? And they're equal, they're strong. I'm gonna also feel for inguinal lymph nodes while I'm down here. While I'm feeling pulses, I'm gonna check your popliteal. He's wearing pants.
Oh, wait, okay.
Pulses are equal, +2. I'm gonna reach in here and feel your posttibial. Great, equal, +2. And I'm gonna feel your dorsalis pedis pulses. Great. I'm gonna check for pitting edema. I don't see any grading pitting edema. Cap refill is less than 3 seconds in the toes. Skin is warm pink. Good circulation down in the peripheral neurovascular.
Okay.
Next, I'm going to have you sit up,
All right.
and it might be easier to just go to the chair.
All
Back
right.
to the chair. I'm going to wash my hands real quick. It's a touch your feet.
That's right. Okay.
I want to be on this side. There we go.
Okay.
So, next, we're going to, I already assessed your strength in your arms, but I need to assess reflexes in your arms. So I'm going to assess your brachial reflex. You feel it? Okay. And then again, here. All right. And then next I'm going to assess your tricep. Go ahead and relax into me. Go. I'm going to do this one. Go ahead and relax into my hand. Perfect.
Great.
Next, I'm going to assess the reflexes in your legs while we're doing that, and then we'll do strength.
Okay.
Okay? So, go ahead and relax your leg into my hand. Good. I'm gonna have to hit it with this one. Good. And, yeah. Your Achilles. Okay. And the next one. And then your Babinski. So this might be a little uncomfortable, but I'm going to check your reflex and reflex.
Yeah. It is there, isn't it?
Yeah. Ready? Good.
I haven't had that done in forever.
All right. Push your or try to raise your legs. Okay. Try to bring your knees in. Try to bring them out. Okay. Pull your feet up to the sky. Push down like gas pedal. Perfect. Next, I'm going to have you touch your thumb to each finger in a rapid movement. Okay, perfect. I'm going to then have you slide the heel of your right foot down your left shin. And then the opposite. Next, I'm going to do check your sensory.
Okay.
Can you feel that?
Yes.
How about now?
Yes. 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 Mhm.
What about down here?
Yes. Yes.
Okay. You feel that?
Yes.
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 Okay. Next, I'm gonna check proprioception.
Okay.
So I'm gonna wiggle some fingers, and you're gonna tell me if they're pointing up or they're pointing down.
All right.
Okay.
I'll close my eyes.
Go ahead and close your eyes. And when I stop, tell me.
Up. Down.
Okay. Next finger.
Down. Down.
Okay. And the next hand.
Okay. Up. Up. Down. Up.
Okay. Perfect. I'm gonna do the same thing with the feet.
Okay.
Hold this out. Go ahead and keep your eyes closed.
Okay. Down. Up. Down. Up.
Okay. Next foot.
Up. Down. Up. Down.
Perfect. Next, I'm gonna assess vibration in your fingertips and in your toes. Okay.
Okay.
And you can just tell me when you don't feel it anymore.
Alright. Okay.
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 Okay, well, that brings us back to the starting wing.
Okay. Okay.
Okay. And then I'm gonna do this test in your toes.
All right. Okay. 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 Okay.
Perfect. Everything is within normal limits.
Okay.
Next, I'm going to assess your spine.
All right.
So I'm going to have you stand, and if you could touch your toes.
All right.
I'm looking for any scoliosis, any curvature, and making sure your spine is straight. Any pain or tenderness?
Nope.
You can really touch your toes. Okay, stand up. I can't. Sacroiliac spine. I'm going to have you, before you walk,
Mm-hmm.
I'm going to have you close your eyes while you're standing. I'm going to test your balance, okay? By protecting you.
Okay.
Okay. Okay. You can go ahead and open your eyes. You seem stable enough to take a walk.
Okay.
Go ahead and walk like you normally would. Okay, come back. Great. And then take another walk on your toes. And come back. Take another walk on your heels this time. And one more walk. We'll go heel to toe.
Okay.
Okay, place, yep. Go ahead, walk like you're walking a tightrope. Okay, you turn around. I see that you have active range of motion in all joints. I'm not going to do a formal musculoskeletal exam during this examination. I did forget one thing, so I'm going to wash my hands and I'm going to look in your mouth.
Okay,
Okay?
perfect.
You think of anything else? So I see the mouth, there's no circumoral cyanosis, your lips are pink and moist, it doesn't look like you're dehydrated. I'm gonna shine this light inside,
Okay.
and I'm gonna use a tongue depressor to kind of get the tongue out of the way. You can go ahead and say ah. Okay, your uvula and your soft palate rise accordingly. I'm gonna then use this and kind of look at your interdental papillae. There's no swelling. There's no dental caries. I'm going to look at the lateral aspects of the tongue. I'm looking for any lesions. I don't see any of that. If you can go ahead and stick out your tongue, move it to the left and to the right. I'm going to then reach my hands inside, okay? I'm going to assess your teeth, make sure there's no looseness. I have the same retainer. No looseness. You don't feel any masses. Everything looks really good.
Great.
Okay. Do you have any questions for me?
Not that I can think of.
Okay. Well, thank you for letting me examine you.
Thank you.